Want normal? State and hospitals say adults should vaccinate and kids get tested. By Dave Orris, Pioneer Press, published April 22, 2021 at 5:34 p.m. Minnesota health officials Thursday emphasized that everyone over 16 should get vaccinated and youth and teens should get tested more frequently if the state is to emerge from the coronavirus pandemic faster. In separate statements and interviews, state health and education officials sketched out a current COVID landscape that is both optimistic and troubling as they addressed the dual-pronged strategy amid a tug-of-war between an increasingly, but far from fully, immune public and the more dangerous variant that is dominating infections and increasingly sending unvaccinated, middle-aged patients to the hospital. As part of that response, state officials introduced a new program to make it easier for students to get tested every 2 weeks, including being tested in school. We really do believe the end of the pandemic is in sight, but we're not there yet, and how quickly we get there is not clear, Health Commissioner Jan Malcolm said in a morning news briefing. Cases growing, but slower. Current growth in cases in Minnesota is continuing, but it's showing signs of growing slower. That's good, but not yet really good news, according to Malcolm's take, as she reported 1,973 new cases Thursday, including 10 new deaths. Nationally, the numbers of daily cases reported has remained stubbornly around 60,000. That's far below the fall and winter surge, but still in the neighborhood of last summer's surge. And with travel increasing amid loosening restrictions and attitudes, epidemiologists have tempered their optimism. Hospitals see case increases with younger patients. The number of COVID-19 patients in hospitals has increased to 683, including 196 requiring intensive care. The average age of those patients has plummeted to 59 years old, down from 69 during the November-December surge. Driving it all, officials said, is the B.1.1.7 variant first discovered in Great Britain. It's more contagious and is now known to cause more serious illness, and it's now making up more than 60% of Minnesota cases. At Park Nicollet Methodist Hospital in St. Louis Park, the change became obvious several weeks ago to doctors working the night shift. COVID doctor, it's distressing. We were seeing no evening patients on many nights, Dr. Natalia Dorf-Biderman, a doctor at Methodist Hospital, said in an interview Thursday. That began to change in the last 3 to 4 weeks. The number of patients of late has topped 40, Dorf-Biderman said, and the patients are markedly younger. It's distressing, she said. A lot of the doctors are the same age as these patients. Even though the younger patients, frequently between the ages of 30 and 60, aren't dying in high numbers, she said it's striking to see the level of lung distress and overwhelming fatigue. While many of the patients have at least one other risk factor, such as obesity, she said a notable portion appear perfectly healthy. One nurse said to me, "I can't believe it. My patients are so young, and they sleep for 12 hours a day. They can barely move. That's very strange for us, because usually younger patients have more energy," Dorf-Biderman said. Health Partners, which runs Methodist, raised the alarm publicly about its situation as their medical and surgical bed capacity reached 90%. That might not sound dire in the context of COVID, Dorf-Biderman said, but it's a serious concern. Can we handle this capacity? Yes, she said. We are used to dealing with emergencies. That's what we do, but that doesn't mean that's what we should do. Caring for people that are so sick is a pressure cooker, and now people staying longer and take up those beds for a longer time. The longer time in the hospital is the result of a positive fact that carries a consequence. This younger cohort of patients isn't dying. Additionally, Dorf-Biderman said that unlike earlier in the pandemic, when hospitals suspended many procedures, people were generally at home, and many are now catching up on previously postponed but important visits, so there's more non-COVID traffic. Unvaccinated getting hospitalized, another clear pattern that Health Partners is seeing across its system. By far, the majority of patients, by far, are unvaccinated or not fully vaccinated, Dorf Biderman said. Malcolm said that while Minnesotans are continuing to be vaccinated at a steady clip, there are signs that demand might be beginning to wane, even though only 53% of eligible Minnesotans, anyone older than 16, have received at least one dose. Empty slots on schedules of vaccination sites are staying empty, according to vaccine providers. The Mayo Clinic has issued public statements clarifying that they'll vaccinate anyone, regardless of whether they're a patient. The state's federally funded mass vaccination site at the state fairgrounds had openings earlier Thursday, and the University of Minnesota said in an email to faculty that stated, "Demand continues to be surprisingly low, and we have several hundred additional doses available for tomorrow's first dose, Moderna, Clinic, at TCF Bank Stadium." Chris Arisman, Director of Infectious Diseases for the Minnesota Department of Health, said officials believe that there are plenty of people willing to be vaccinated who have thus far held off, primarily for two reasons. They wanted to let others who are more vulnerable get theirs first, and they were discouraged by the initial rush that created frenzied, late-night online sessions to try to book a slot for a shot. Arisman's message: to these people, I would say, thank you for allowing others to go first, but it's okay to take your place in line now. You don't have to be up in the middle of the night to get an appointment. Free school testing offered. Since in-person schooling resumed, state officials have urged middle and high school students, who are mostly ineligible for the vaccine, to be tested once every 2 weeks. But officials said they don't believe enough students are getting tested. Minnesota's Education Commissioner, Heather Mueller, on Thursday announced a new state program that will provide free tests for any school in the state. Exactly how that will look is being left up to local school officials, but Deputy Commissioner Dan Huff described several options based on the saliva tests offered by Vault Health, which has a contract with the state for some free mass testing sites, as well as the state's free Test at Home program. One option could be for students to pick up a test at school, take the test at home while on a video call with a Vault worker, and mail the sample to the lab. Another option could be to do the same test during school hours at school. In such cases, officials emphasized, parental consent is needed. Because there have been a number of cases of the coronavirus outbreaks on teams, and because such outbreaks can disrupt a team's season, the state recommends student athletes be tested weekly.